Hello and welcome to What I've Been Thinking with Marcus Cage. I'm your host, Marcus Cage. In this video, I want to talk a little bit about the pandemic which is going on. Whether we call it the coronavirus, COVID-19, or whatever derogatory names which people have been throwing out there, I won't go in and repeat any of them. The topic that I want to talk about with you guys right now is I want to talk about the pandemic, and I want to talk about why we need Medicare for all and why the pandemic proves exactly why we need Medicare for all. With that said, we'll get straight into the video. Thank you for joining me. Please like, please subscribe, please tap the bell, and please comment if you feel like doing that. Without further ado, we'll get to the video. Thank you. Hello, and thank you for joining me. All right, we'll jump right in. On this one, we're talking about the pandemic and why we need Medicare for all. Now, you heard plenty of people make their statements. For instance, they talked about Italy, how Italy is having problems with the system. They're not having problems with the system. They're having problems with the pandemic. The system, if they did not have it, would be much worse. And it is the reason why we are having so many problems right now with trying to contain and trying to deal with this thing. I mean, you look at how hard it is just to get general masks out. You look at how the government is struggling to be able to produce respirators. You look at all the different issues that we're having. My biggest issue that why Medicare for all is definitely why this pandemic shows we need it is because even if we had the exact amount to test every single person, which we don't, we're nowhere close to it. Even if we did have that, because people have copays and deductibles, people are not going to go to the hospital and get checked. Therefore, continuing to spread the disease because they're not going to get checked. Plenty of people who are asymptomatic, when they hear that they can walk in there and possibly walk out with a $32,000 bill, which I've heard that's happened for people, it's going to make people not go in there. As long as we have this patchwork of thousands and thousands of companies which are trying their best to try to figure out how they can still make money in this pandemic, this is another example why we need Medicare for all. What I've noticed, and I've lived in plenty of places which have had natural disasters. I grew up in Tornado Alley. I lived for many years in the middle of the hurricane zone. I currently live in the place that has the most earthquakes in the United States. California have wildfires that are out here, which I've seen numerous times. I've also lived next to an active volcano. What I've noticed is whenever you have these kind of things which happen, there is nobody but the government who can come in and who can facilitate and fix and make people whole in these situations. Capitalism is a wash. It does nothing for you in those times. What capitalism normally does is it leads to making things worse. You have hoarding. That becomes a big issue. Overpricing or gouging becomes another issue. You start to have problems with starvation, things like that. Those are all the things which start to happen in these more capitalistic systems. Now, our healthcare, being an extremely capitalistic system, is only built on how it can benefit those doctors, that hospital, and the corporations which benefit. It is not set up for healthcare. That is where the problem is. Medicare for all is a healthcare system that is set up to deal with health. I mean, a lot of people they make the argument that, well, our healthcare system is so great and we have people that come from everywhere and this and that. That is true. But what they're not explaining in this is these are people who have money. And if you have the money for whatever surgery you have, you can come to America and get the best of the best doctors and surgeons. That is true. But what the problem is majority of us don't have a lot of money. Majority of us are just going to the regular doctor's office and paying tons and tons of money and getting average to mediocre care. We're not getting any care that's so much better than any other place around the world because we're just average folks. We're not getting the top of the line surgeon because we don't have 300,000 to pay this surgeon to do our surgeries. If you look at what our system does, the reason why I say the pandemic exposes why we need Medicare for all, because it shows what our healthcare system actually is. I've known people who have had very extensive surgeries. For instance, for gastric sleeve, that can range you easily 100,000. Now, that's of course insurance paying their certain amounts, but that's how much the sticker price is on something like that. In another country, in most other countries, that cost is a tenth of what we pay here. And therein lies the problem. It doesn't cost anything if you have, say, a broken bone for them to actually deal with it. X-ray, which X-rays actually don't cost very much. They've already paid for the machine a couple of times over. It's free. It doesn't cost them anything extra to take an X-ray image. Also doesn't take them anything extra to get some cast molding, some bandages, reset you, or painkillers, reset you in place, wrap you up, and then send you out of the door with crutches. But in America, who knows how much you pay? I'm just going to throw out random numbers because the numbers in our country are certain enough that any number I throw out could be true, depending on where you are. They could send you out. Next thing you know, you owe $35,000 for that broken bone, whereas you can be in most European countries, have that same exact thing happen, and you're walking out with maybe paying a couple $100 total. And yet people argue for this backwards, dumb, profit motive driven system. Think about it like this. If you want to have something, if you have something serious that's going on, how much fighting do you have to do with your doctors? Now, some of the younger people who are listening to me, maybe you haven't had some of these issues. Maybe you have. Maybe you've been there with your parents or grandparents or other loved ones and had to haggle with doctors about, well, are you guys going to cover this? Or are you going to cover that? Well, you should be covering this. You say you were going to cover that. We pay this much per month, whatever. In a Medicare for all system, that shit ends. There's no more, well, what about this and what about that? You're just covered. You're just covered. Another thing which in this pandemic shows, if we had Medicare for all, after the fact, when these people have been treated and they're going to need to go to the doctor later on, because they've showed that a lot of these people who get it and then recover from it do have scarring of the lungs and have residual side effects. You're going to need health care. If you can't afford health care, or if you're dealing with some Obamacare or public option nonsense, you are not going to be able to afford to pay for this. And you're going to be in the same shoes of those people you see going bankrupt every year because they can't pay for their cancer treatments. The reason why we need Medicare for all, and the reason why anybody who argues against this is either extremely uninformed or a dishonest actor, is because it works. It works in multiple countries. It is South Korea who's dealing with a pandemic. You want to know why they didn't have as much problems as we are? You want to know why they're handling things much better? Because of their universal healthcare system. Every single person who needed to be tested was able to go and be tested for free. If they needed masks, that's not a problem because they still have production in their country to say, you know what? Stop making t-shirts. We're making masks. In America, because we've let a lot of our ultra wealthy with NAFTA and CAFTA and all these other stupid trade deals ship the production out of this country, it's hard for us to be able to build any masks right now. That's the reason why you have such a shortage. That's the reason why you have a shortage on ventilators, because we keep shipping everything. Well, not we, our major corporate overlords keep shipping everything overseas so they can keep on making as much money as possible without having to pay workers. Now, I could understand that if you're sitting up there on a couple of thousand and you're just barely skimming by, but we're talking about people who are sitting on multi-billions and still on top of all the money they have, they still try to find every single way to not pay people and to be even more greedy. I mean, you look at this bailout, and I'm going to talk about that in the next video that I drop, but you look at this bailout. These are the richest people ever, and they're out there with their hands out. Oh, poor me. I mean, another thing that this pandemic shows, if we had Medicare for all, for one, I feel like a lot of the pandemonium would be calmed down and relaxed. Another thing, if we had Medicare for all, because here's the thing, since the system is being battered right now, because of, for one, its own built-in inefficiencies, but two, because of the major influx that it's facing because of all the COVID cases, well, there's still other people getting sick from other stuff. There's still people who are falling down and breaking a wrist and need to go to the hospital. There's still domestic violence, which is going on, and some woman gets beat up by her husband and she needs to go to the emergency room. There's still people who are out. Maybe they're a bike delivery person who gets hit by a car and who's still going to need to go into the emergency room. There are still many of other issues that are going on in our system. And because we have set up our system so inefficiently, a lot of these people are getting left out in the wind. A lot of these people who might have dialysis, they're getting pushed to the back because of the worries about COVID. Women who might have breast cancer, they're getting pushed to the side because of that. Some of these children who might have been born with leukemia, they're being pushed to the side. Now, if we had a universal healthcare system, we could hire other workers. We could bring in workers from the private sector to bolster the numbers. To say, you know what? Hey, we have these unemployed people here. Maybe we can have them organize this or do that or whatever. But we're not doing that because we don't. If you look at the response is nothing. It is, okay, well, whatever this state to that state to that state, or whoever is doing this is the leadership we're getting from our president right now. In this COVID thing, we'll just kind of figure out how it works, and I'll just say a whole bunch of crap and hope that I say enough positive stuff that it'll just change the reality of what's going on. And then we have Sleepy Joe Biden, who wants to hide out, and when he does come out, his interviews are so horrible that the interviewer normally sits there and acts like they're having a normal conversation. I don't know how that's playing with people at home who are watching it, but to me, it's mind-boggling that nobody has actually just asked Joe Biden to drop out. I mean, he looks abysmal. He sounds abysmal, and he's doing nothing. Oh yeah, and on top of him doing nothing, when he does pop his head up to say something, it's normally something which loosely either Trump alluded to or trying to still argue that Bernie's plans are not proven to be more superior right now. Joe Biden is still arguing for insurer-paid insurance. Insurer-paid health insurance. Well, last week we just had 3.3 million people lose their jobs. That means 3.3 million people just lost their health insurance. Now, I predict that we'll see 5 million this week, and it's going to continue to escalate for at least probably a month or two. I'm the reason why I say a month or two, because if you look at how things are going on in China, which China is much further ahead in this process, most of their streets are still shut down, and it's been about 2 months. That's where my 2 months comes in. So I could definitely see right now this going easily into June, where we might be possibly still shut down like this. Um, so with that said, more people are going to lose their insurance. And as more people lose their insurance, how are they going to go in and be tested for COVID-19? You see the dilemma with Joe Biden's, health plan tied to your job. I mean, it's kind of a dumb idea. Also, if you have a universal healthcare system, back when things are normal again, you don't have to sit there under that boss, which you can't stand. You can say, you know what? Deuces, I'm gone. You can leave. You can go somewhere else. But in this current system, in the system Joe Biden wants, in this system, well, I don't even know what the hell Trump wants, because Trump is just saying, I'm going to cover people, but he's not doing anything. So I'm not even going to address him. But what Biden is saying is, let's just keep the status quo. I'll find some way to try to make sure you guys pay a little bit less. And to a good chunk of the population, apparently that's a good enough freaking argument. I think it's insane. Also, the fact of, think about what happens if you say you have your healthcare through your employer. What do you have to do every single year? I've had to do it numerous times. I mean, once I got out of the military and I start seeing how healthcare is done, it's like, these people are insane. I don't know why anybody doesn't fight against this system. I don't know why anybody wants to do this. I don't know how anybody argues for this. This is the most cost effective. Most costly program, and the hardest to figure out. I mean, every single year, I'm pretty sure most of you guys have to do this also, have to sit down with your company, and HR comes down, and for half a day, they explain or try to explain the healthcare. And, well, if you use this HMO or this PPO during that time, well, it's technically cheaper if you use it here. But if this would have happened and you did that, then that's cheaper. That bullshit needs to stop. And people agreeing with that, that's insanity. It is just a shell game so they can sit there and hustle you. It's time to get rid of that nonsense and stop being a sucker. I guess, with that said, I'll end the video here. I've said enough on the topic, but in this day and age, especially with this pandemic, there's no reason that anybody out there listening to my voice should accept public option or Obamacare or any of these solutions. They are completely insufficient, and the people who are proposing it know it. That's all I'll say. You guys have a good one. Thank you.